So I'd like to tell you about the upcoming program, the Pain-Free and Healthy Back. This will be the third edition of the Healthy Back program. I am quite proud of it. I've been a physical therapist now for 31 years and a Feldenkrais practitioner for 22 years. Oh, how funny, 22 years of my practice. And the program is a marriage of physical therapy and rehabilitation medicine, evidence-based, meaning what we know right now, what's the current knowledge of rehabilitation and physical medicine about lower back pain and sciatica issues. So the program is heavily influenced by this, by knowing what's up to date in terms of recovery and healing. The second part in the program is the work of Dr. Hans Kraus, with whom he was a pioneer. He's considered one of the fathers of physiatry in the United States. He was President Kennedy back pain doctor. And his contribution to medicine was in creating a system of treating and diagnosing muscles, pain of muscular origin. And also, he created an exercise program that was geared toward the lower back pain recovery, the low back pain treatment. And his program, there were studies of these exercises, and over 80% of participants improved. Even people who failed previous surgeries, botched surgeries or surgeries that didn't bring any relief, that group even improved more, because the studies show that up to 84%. So we have the merger of the physical therapy, merger of Hans Kraus' legacy and what he taught me. I had the privilege and honor of working with him during his last years of his life. The third part that's contributed to creation of this program is the fabulous work of Dr. Moshe Feldenkrais, the work of nobody as Feldenkrais knows movement. Nobody as Feldenkrais knew how skeleton, nervous system, muscles, and our way of interacting with our environment influences our health, our well-being, our efficiency, our happiness. So this program is also based on Dr. Feldenkrais' work. In addition, I included in the program science of habits, what we know about habits, because to improve, you need to address habits. There is no way of getting better with back pain, especially chronic pain, because there is a different situation when you have acute pain. Acute pain is the pain that is just started within the last few weeks or up to 3 months. That's acute onset of pain. And nature deals with acute pain very well, meaning you can confidently rely on your nature, on the nature. It's going to heal you. If you just pull your back, the chances of you being pain-free within the few weeks is very high. Some people, however, don't heal. In terms of chronic pain, the nature is not a good thing to rely on, because otherwise it would be already better. So if you had pain for more than 3 months, relying on nature and on habits is not a good idea. You need some extra input, and the science of habits has much to offer. In addition to it, I use my knowledge as an athlete and as a coach, fencing coach. So in terms of training, in terms of changing patterns of movement, I draw on that. And another last contributing part of the pain-free and healthy back is mindfulness and some aspects of Buddhism that I find very useful for healing, for in terms of how to be kind toward yourself, how to truly love your back, really how to learn to love your back. And mindfulness practices and Buddhism has beautiful blueprints. So this program is a combination of these things. Is the program for you? So the program is for 3 groups of people. People who are in chronic pain, meaning more than 3 months. And I work with people who have sometimes pain for decades of everyday suffering. In fact, the number of people who have back pain is unbelievable. That 19% of adult population of the world have the pain right now as we speak. 19%. And 23% will have pain in the matter of month, during the duration of 1 month. So back pain is something very, very common. And the group of chronic pain sufferers, group of acute pain, meaning something new, I find that this is a very important to address, to treat, to start treatment as soon as you can. When you have an acute pain, don't wait, don't procrastinate, start addressing it as fast as you can, because it will go, your chances to healing are much faster if you address it early. You don't want this to become a chronic, because chronic condition, like I said, it requires some work. It requires some engagement that is much more intensive than people with acute pain. And the third group of people who come and benefit from this program is people who don't have back pain, but would like to learn tips and learn how to preventive group. The program is not for people who want just quick fix and don't want to be part of it. Sometimes patients come to me and say, could you tweak me or pop my back and make that pain go away? As great as it sounds, usually majority of people don't get back better like that. You really need, we know from medicine and from evidence, you know what works? Education and active involvement of the participant. Meaning, as soon as you can get from the passive treatments, meaning some people are doing thing on you, for you, working on you, to you taking control in your own 2 hands, the fastest you will get better. We know there is tons of evidence that passive work doesn't work as well as active, meaning engagement, you being proactive, you being excited about your future and working on yourself and learning. For that, you need curiosity. You need to be curious about your own body, about your own spine, about own tissues, how you move, about your own habits. This program is for people who are seeking tools for effective exercise routines. We are going to, in 22 days, I'm going to show you 33 moves, 33 exercises that will constitute your home program. Some for you will be tweaked. We will do individually tailored work. So for example, in certain exercises cause strain or pain, we'll eliminate them from your program. You will do just the work that works. So this program is for people who seek how to learn an exercise program and learn it in depth and be very proficient about it. Know how to do movements properly. That's the program for you. And also people who are interested in introspection and reflection. Some people have hard time, cannot stand being quiet or close eyes and being with themselves. That could be difficult because we will be paying attention to ourselves. A little bit about our methods that are used. So we'll be searching for remedies for back pain and sciatica. Simple home program, like I said. Increase flexibility and strength. It will be no-nonsense knowledge, what to do and what to avoid to alleviate pain. Strategies for setbacks. The word about setbacks is that for chronic pain population, setbacks, flare-ups are normal. Don't be afraid of them, just like you're not afraid of getting cold. It's part of life. It happens. You get through it. You get better. you can also have the same viewpoint on setbacks and flare-ups of back pain. We'll work on prevention, we'll work on relaxation, trigger points, posture. We'll touch upon ergonomics and creating solid, good environment for your healing. You may ask about how successful, there were some questions, how successful is the program? I'm quite proud. We had in the first two programs, two editions, we have a very good feedback of people. 88% of participation thought it was much better than they expected the program. Actually, 97%, it's unbelievable, 97% felt better after completing the program. So my hope is in the future, as we build this program, as we move to next editions to do some studies, scientific studies, where we could compare groups of patients who would do exercises, just regular exercises or different approaches or no approaches at all, and then compare our program with that. So feedback has been great. As always, that we need to invest into our health. Our health is precious. Our health is, you cannot give anything to the world, to others, if your health is failing. So taking care, investing in your own health